I invite you to watch this movie. Vertigo. Vertigo is a feeling in which the patient thinks the whole room is turning, as if he is falling out of bed, that he is lying on, or off the chair he is sitting on. Usually it happens during the night. It is caused by viral infection of labyrinth. Inside the ear there is something called labyrinth, and this labyrinth is an apparatus. If you do neck exercises like this constantly in the morning every day, vertigo will disappear after exercising for 2 or 3 days. In 2 or 3 days you will be relieved of vertigo. Epistaxis, that is bleeding in the nose. Children of age of 3 or 4 years, or even 18 or 19 years, from even 20-25 years, start getting blood without any pain or other indication. This nosebleed is called epistaxis, and this can occur due to weakness of the inside of the nose, due to viral infection or other causes. This bleeding will alarm the patient as well as parents. The best thing first time is to press the nose and breathe by mouth. Breathe by mouth while pressing the nose. Breathe by mouth and then hold the nose. That way you can temporarily stop the bleeding. And if you hold it for a little longer, then it might stop by itself, and if not, you have to go to the doctor. He will use a gauze ribbon soaked in petroleum jelly to pack the nose. Blood must not be swallowed. It is important to inform the patient not to swallow the blood, because if he swallows the blood, then he gets irritation in the stomach. But then he must be allowed to bend the head so that the blood falls outside and he does not swallow it. Even if he gets the blood in the throat, he must be asked to spit it out. Day-to-day activities of eating, drinking, sleeping, going to school, working in the office, attending to the shop, to our business, all these activities produce some changes in our blood pressure, heart rate, and reactive changes in the hormonal levels, and even in the glands that produce these hormones. Emotions may be long-standing and continuous, and the effects on the blood pressure and rate of heart can be more than normal. Also, stress of pregnancy and childbirth in women, overweight and obesity in both men and women, excessive alcohol consumption, death of loved ones, losses in business and land disputes, court appearances, examinations and interviews, job problems, love between two young couple, creating problems. There are so many different situations, not all can be mentioned here, which can produce emotional stress in any person. These are the causes for a rise in blood pressure, which might be dangerously high, producing enlargement of the heart failure, brain hemorrhage, etc., and accelerated thickening of the arteries, producing carotid artery disease and heart attack. This condition of raised blood pressure is called hypertension or high blood pressure disease. When a doctor examines the patient, he takes the blood pressure and tells you if the blood pressure is normal. If the blood pressure is 140 by 90, it means the systolic reading is 140 millimeters of mercury, and that the diastolic reading is 90 millimeters of mercury. The blood pressure test is a test of arteries by compressing them so that the blood which flows through the arteries get blocked. And when the pressure is slowly released, the systolic reading is when the first sound is heard, and the diastolic reading is when the sound disappears. It is not unusual for the blood pressure to remain high during the emotive episodes, but it comes down to normal later, especially in those who are not suffering from hypertension. Start inflating this cuff until it shows 200 and then slowly release it. This is where I hear the first sound. That is the systolic blood pressure, 120. Then you go release it further and see when this sound disappears. Now here I see where it has disappeared, 65. That is how you check the blood pressure. Always write down the blood pressure. Now I will show you another way of taking blood pressure, and this also can be used. You put this on your wrist, tighten the cuff, switch the machine on. The patient should be lying down on a bed or sit on a chair, and the hand should be at the level of the heart. Soon after switching it on, the machine starts running, and in about 2 minutes it shows the results. So if the blood pressure is high at one visit to the doctor, then it cannot be diagnosed as high blood pressure. Only if the blood pressure remains high during all and every visit to the doctor, then only we can suspect that the person has high blood pressure disease. Usually overweight and obese people are at risk for developing high blood pressure disease. So the first treatment is to lose weight by eating less and doing exercise. High blood pressure can cause too much work on the heart, and the heart will enlarge and ultimately begins to fail. This is called heart failure. If the high blood pressure remains unnoticed for more than 2-3 years, then it causes thickening and weakening of the arteries everywhere, including the brain. Therefore, there can be leaking of blood in many organs. Therefore, when there is leaking of blood in the brain, there will be stroke and paralysis and even death. So, it is necessary for us to keep a watch on our blood pressure and begin treatment for it if it remains high persistently. If you want to know whether you are healthy, then you go to a doctor. Then we will take your history regarding your health and then examine your blood pressure, your pulse, heart and lungs, your nervous system, your joints, movements of the limbs, ankle swelling if any, and look into your mouth and throat and examine your abdomen and look for the size of your liver, spleen, etc. Then he might ask you to get an ECG done for heart, ultrasound of the abdomen done, and if necessary ask for an echocardiogram. Then he will ask you to get certain blood tests done, such as hemoglobin, WBC cell counts, fasting blood sugar, and a urine examination, including microscopy study of urine. But these days there is another test commonly done, and that is lipid profile. That includes cholesterol, triglyceride, LDL, HDL cholesterol. He might also ask for liver function test, urea and creatinine, uric acid, and sometimes potassium, sodium, and thyroid tests. All these tests have their value, and if there are any abnormalities in these tests, he will then continue to focus on these abnormal tests to investigate further and finally give you advice and a prescription.